Question 66. Upper urinary tract and ureters. Upper urinary tract is composed of renal calyces and renal pelvis, and then you have a ureter connecting kidneys to the urinary bladder. Firstly, the renal calyces. You have minor that collects into major calyces, and the minor ones are attached to the medullary papillae. Now the renal pelvis is the one that collects all of these calyces and is placed in the renal sinus, leaving the kidney through the renal hilus, and it continues into the ureter in the pelviureteric junction. The anterior relations of the renal pelvis. You have the right one is the duodenum. The left one is the pancreas, which would lie here. The blood supply and nerve supply of the renal calyces and renal pelvis is the same as the kidney, so the renal arteries and veins, and a nervous plexus, abdominal sympathetic plexus, and parasympathetic fibers from vagus nerve. Now the ureters are about 25 to 30 centimeters long, 3 millimeters in diameter. It has 3 constrictions at the junction with the renal pelvis, or where it begins, where it enters the pelvis, and where it enters or passes through the wall of the urinary bladder, which is this one. The ureters have 2 parts. You have abdominal part and pelvic part. The abdominal part of ureter lies behind the peritoneum on the psoas major muscle. It crosses the genitofemoral nerve, which would go here. Genitofemoral nerve. And the ureters are crossed by gonadal vessels. And it crosses the common or external iliac vessels. The right ureter is crossed by root of mesentery, which would go here. And the left ureter is crossed by attachment of sigmoid mesocolon, which would go here. The pelvic part of ureter runs in extraperitoneal areolar tissue. It lies in front of internal iliac vessels. This is internal iliac artery. In male, the ureter is crossed by a deferent duct and is related to seminal vesicles, which would be behind the urinary bladder. This is a female. Here you have uterus and vagina. So the ureter lies behind the ovaries and descends near the uterine cervix and upper part of vagina. And it is related to uterine vessels. Here's uterine artery. And this is clinically the most important relation of ureter. The blood supply for ureters are branches from renal arteries, from gonadal, iliac, and uterine and vesical arteries. So branches from those 4: renal, gonadal, iliac, vesical arteries. The nerve supply is by abdominal and pelvic autonomic plexuses.